Hello, everyone. This is Johnny Farias again, and thank you for tuning in to Community News. Today, we're going to discuss a topic that's one is true to our heart because it's directly in my family, and I'm pretty sure that a lot of viewers is going to do the same because I was reading about breast cancer. The American Cancer Society says about 1 in 8 women in the United States would develop lung cancer during their lifetime. 1 in 8 women is a lot. Well, today we have 3 guests. I'm going to have them introduce themselves so you know who they are. I guess let's start over here.
Hi, my name is Nicole Moreira, and I am a triple negative breast cancer survivor. I'm 28 years old, and I just finished treatment.
Thank you for joining us. Doctor?
Hi, I'm Dr. Danay Rodriguez-Arritola. I am a nurse practitioner and the chief nursing officer for Larkin Community Hospital. I've been in healthcare for about 23 years. Thank you for having me.
Well, thank you for everything you do.
Yeah, thank you, Johnny. My name is Angel Farias. I'm a surviving spouse. Unfortunately, my wife passed away 2023. This month marks 2 years, and she was diagnosed with HER2 negative.
Thank you, everyone. By the way, when I say that his home's because this is my brother. My sister-in-law is the one that passed away. Also, they have 3 boys. Ages, is that what the ages?
Yeah, 17. One will be 14 now in December, and another one that just turned 6.
6. So those are young boys, and I want them to come on the show because we focus a lot on many topics when it comes to cancer, people that that have it and when we lose them, but also we got to remember the people that they leave behind. But anyway, Nikki, just to get with you first, thank you for being here. Now, Nikki, I know Nikki because she was in my Girl Scout troop back when I was a Girl Scout leader. So these are all familiar faces to me. When I found out that you had cancer, I was devastated because I've known you from young. Okay, you're a mom.
Yes.
So tell me, how did you find out?
I was breastfeeding at the time, and I just felt a lump. I didn't have any symptoms or anything at all that I could have potentially pinpointed that it would be cancerous. I decided to hold off a little bit and wait until I had slowed down on breastfeeding. At the time, I was breastfeeding about 10 to 12 times a day. Waited till he was about 2 years of age, and I slowed down to about 2 to 3 times breastfeeding. And I felt the lump that was still there. So I decided to go ahead and get it checked out. Spoke with my OBGYN, and she immediately got me in for an ultrasound. That came back highly suspicious. So we went ahead and proceeded with a biopsy. And the biopsy proved that it was triple negative breast cancer grade 3. So the rarest and most aggressive form of breast cancer.
Wow. And I saw that you rang the bell.
I did.
Can you explain to us so the viewers know what that is?
Yeah. So ringing the bell, a lot of people associate it with completion of, or I should say, complete response where you're cancer free. It's not. It just means that you're done with chemo. So I just had my last chemo treatment. I had 14 treatments. So I just finished it 5 weeks ago.
Wow.
And last Friday I rang the bell. So I'm done with treatment.
Okay. And now you're going into surgery.
I am going into surgery. Yes. I'm going to have a bilateral mastectomy.
Wow. And I asked you earlier if you were scared, and you said yes, which obviously, I mean, even I'm scared, I'm not going to do it, but
yeah.
But just you have more support now. You and your mom has been family for this ever since Girl Scout. So please also always reach out, even not only for the show, but afterwards, please.
Of course.
Definitely.
Thank you so much.
Doctor, one of the statistics that I just read, it's incredible. And these young ages, it's not all the women anymore. Now, they got to start checking those from when they're young.
They're seeing it more and more. Younger women, there is no explanation for it. Sometimes you have a genetic. I'm very good friends with 2 twin sisters. They both tested positive for the BRCA hormone or the gene. one of them already had.
What's the BRCA hormone so we know?
So the BRCA gene is a test that they do to see if you have the BRCA mutation, which means that there's a very high percentage that you will develop breast cancer. Angelina Jolie is a perfect example of that.
Yeah.
Her mom died of breast cancer. She had the lab work done. She tested positive for BRCA, so she did at a very young age, had a mastectomy. These two sisters are two twins. One of them, they both tested positive. One of them already had a lump. So they both decided to have the complete bilateral mastectomies. And it was interesting. Have you guys heard of the term previvor?
Yes.
One of my, until I met them, I didn't know about that term previvor. What that means is you have somebody that's very close to you that's a survivor, and through them, you get tested, you realize that you have a very high incidence of developing breast cancer. So through them, you do all of the necessary steps not to get it, which what they both did was mastectomy and hysterectomy, very young, and they didn't have kids. And it's a beautiful story because they're twins and they went through it together. I just did a panel discussion at Miami-Dade Hialeah where both of them were my guests. And they talked about how, it's an incredible journey for the one that did have the cancer and for the one that now has a much higher probability of surviving and not having the breast cancer develop because of her sister. So they, with so much research that we're doing, we have a few answers, but we don't have enough. For your example, so very young, you seem like a very healthy person. You were pregnant at a young age, which is one of the things they say that having kids and breastfeeding kind of protects you from it, but so young. And look, you had one of the most aggressive forms. So much research that we're doing, but yet we don't have enough answers. And we're seeing more and more incidents of cancer.
I do also have a genetic mutation. So I'm not BRCA1 or BRCA2, but my genetic mutation is RAD51C, which is also linked to ovarian cancer as well. So the same thing, they actually recommended, I believe when I reached 40 or 45, to have a hysterectomy done.
Wow. I lost the question I was asked because as a guy, obviously, I don't understand. I went through a small scale with my wife and obviously my sister-in-law. And even then, I still don't understand it. But I know that it's painful. It hurts everyone around. I know what I was going to ask now. So they haven't really found out what causes any of this stuff, huh?
Well, so everybody does have cancerous cells all over the body.
Right.
A cancerous cell is just a regular cell that starts to mutate and just starts to grow, and it doesn't follow like the norm succession of your cells. So at any point in time, we can all develop any kind of cancer. So you do have surveillance cells that they go through your body, and when they see these cells that start to mutate, they tend to attack them.
Mm-hmm.
Why those surveillance cells fail, they haven't been able to figure it out. I mean, the human body as it is so amazing. There's so many things that are unanswered.
Right. Because
if you do have these surveillance cells, why did it fall on you, or why did it fall on certain people, and why do we develop cancer? A lot of money is going into studies. Do we know the exact answers? No, because then we would be able to diagnose way ahead of time. Now, there are certain lab works that you can do that are called cancer markers. Are all the doctors doing these cancer markers as a part of your primary care, which I think primary care is the most important care? I don't think that I'm seeing right now where primary care physicians are drawing those cancer marker, tests at a specific age.
So my neuropath actually went ahead and did it to get a baseline, but my oncologist doesn't do it until after I'm done with surgery, which I believe should be done preventatively, or at least if you are diagnosed ahead of time as well, to have some type of baseline.
I would agree that if we have certain tools,
let's use get you sooner. Yeah.
If at 40, I can say, let's do these 26 cancer markers just to see. They may come out positive, they may not. But if they come out positive, we can do further research to see if you're in that danger zone.
Wait till 40? Because I read also in that, I think the youngest age was 10 years old.
My oncologist has seen somebody who's 19.
So, I think we should start doing this younger.
Yeah.
Or at least maybe not 10 markers, but let's start with 5. something. I mean, because it's a lot, and I mean, breast cancer is one of the. And I read, like I said, I read a lot before coming over here, because I wanted to be more familiar with it. It's one of the largest killers, among women.
Yeah.
So I think that's something that our legislators should take up. We need more women legislators. That's what it is. So we can get them in there.
I think people really need to put the importance on preventive medicine. There's a reason why it's preventive.
Right.
And we have so many tools right now that can help us. I think our major focus right now, when you look at preventive medicine, a lot of times is, are you hypertensive? Do you have cardiac history? Just the very basic markers, but there's so many other things out there. So if we're seeing a high prevalence of patients that are now being positive to any kind of cancer, and we know there's specific tools, let's change it. We can change that through the Oncology College of Cancer Medicine. They can dictate the standard of care now is going to be that at 20. Since we're seeing such a high influence of this kind of cancer, we can now
Right.
test for these certain things. They can write that out, and not necessarily legislatively. The experts in cancers are the ones that should be going to the legislature and saying, hey, we need to work on this because we're seeing a high prevalence of these things.
Okay.
Is that happening? I don't
think so either, but okay. Before we get into some resources, that's another thing I want to get into. Let me just touch a point with Angel. Angel, the kids, I mean, I know it was hard going through this. Bill, your experience, if let's say someone's out there going through this, what would you tell them? How would you go about explaining this to the children?
That's a really hard question to answer. I think you got to know your children. I got 3 sons, and I spoke to them each individually, because I more or less understand their personalities from raising them. I have a son that's very emotional. Then I have a son who's very stern and is almost hard to move him, impossible, right? So, I would say you have to talk to them, and the sooner the better, because it's something you want to brace yourself for, right? It's kind of like an accident. You see it coming, you want to brace yourself, because that's the kind of thing that this comes with, right? Because it's only a matter of time till something goes really bad, right? And then you have people who surviving, right? Even then, you survive the treatment, and which is remarkable, right? Because overcoming the illness and the condition is tough, but going through the process of treatment, there's a difference, right? It's not your normal day-to-day that you're used to. So you should brace your children for that as well. I mean, I would say at the most fundamental level, I mentioned to them that their mother's sick, right? And she's doing bad, and that she needs help, and that we're gonna help her. Things are not gonna be the same how they were yesterday or last year or last month. And that's it, right? Because at that point, I think their awareness, right, when they see things and they feel differences, they can attribute it to that, and at least know what's the source of the difference. Like, why are things maybe uncomfortable? Why are things hasty? Maybe why they're not seeing mommy in the same energy, right? Why they're not seeing her in the same joyful that she's usually in. So I would say you have to tell them that the parent is not doing well, and that she's getting treatment, and that, everything's going to be all right. Because I think at the end of the day, even with dealing with this, I think everything's going to be all right. You're going to go through a tough time, but that's just what it is. It's no going around it.
It's been 2 years now, right?
Well, at the end of this month, it'll be 2 years since she's passed. But, I think that the moment from when is the diagnosis and throughout the treatment, it's a very critical moment for me. It was like surreal, right? You ever have moments in your life when you don't even know how things are happening. They're just happening, and it doesn't even feel like you're there, right? Like you're not even alive. It's almost like you're in
Surviving.
like in a simulation or something, like in a dream. In hindsight, I'm almost just starting to react now, right, within the last 12 months. But, that 1 year she got diagnosed at the beginning of the year, and, she passed towards the end of the year and the following year. So those 2 years, it was kind of like, I was doing things because I knew it was my obligation. I had to meet with my children. And they really were the driving force behind my motivation to just get up, because it was a big hit that I took, not just me, but, her family, right? Her side of the family, my side of the family. But, it's like that treatment period is critical because it's so many questions, it's not enough answers. And listen, you even speak to other, people who are going through it as well. They don't have the answers either. It's a very mysterious thing. It's like kind of like, I don't, it's so many things I could tell you, but that moment during treatment, I would say is probably just as baffling as after they pass away. It's a tough moment. So, I would tell people, you got to hang in tight, be there for your family, be there for your children. And that's it. It's going to be a rough ride, but, you'll see the other side. And, in due time, we all find peace.
You said something that's amazing and remarkable because most people don't realize something really important. You looked at the characters of your 3 children and you knew you had to speak to them differently because they were different. They're different people. That is amazing, at least for children, that you speak to them at the level that they're going to understand you, because most people just gather the whole family and boom. You took the time to speak to them individually, which that's great insight, especially for you being dad, to understand this person's very fragile. This is my tough guy, and this is the guy that can handle it. So that is awesome insight from you. That's a great perspective.
Thank you.
Well, I mean, and not because he's my brother, but I mean, I give him a lot of credit. I mean, I kind of admire him and look up to him in a certain way because, a single dad. I mean, look, mostly as a man, I could say I've known other men that would just, oh, let abuela take the children, because I can't deal with this. But he didn't do that. He didn't. He's there, and I mean, he doesn't like asking for help, which I understand. But we're family, and he knows he can count on us for anything. But and I, me and my wife, we raised 5 children, and it was hard. I can't even imagine what it is for either a single mom more a single dad that who's got to deal with the schools and everything that I remember going through with my wife. So I take my hats off, and I don't tell him as much, but I am very proud of him and what he does, and he knows that we're here to support him and my nephews and anything. But yeah. Yeah,
thank you. I mean, it is great to talk with you guys. I mean, we have Nikki here. She's going through a situation, and making that decision to get the treatment is tough, right? That's like a big mountain to cross. And, it's good to talk to people. I think I would add, like you, it's good to talk to people who have been through these kind of situations or are going through it, because it is difficult to relate. Like you said, like I didn't know what it was like to fill, or at least attempt to fill my wife's shoes, right? Because even to today, there's just things that I know I would not be able to meet those standards, right? But I do my best, right? And, that's what helps me sleep at night.
Have you ever thought about maybe creating a support group, or are you in a support group?
I'm not in a support group. It would be great to create a support group. To be honest with you, I think I barely have time to tie my own shoes. It's just what it is. And I got to prioritize. That would kind of be like almost like a fantasy.
I just think that you could maybe help a lot of other dads that are going through this. It's very impactful, the fact that you spoke to each and every one of your children, because you understood that the psyche was very different for all 3 of them. So I think that you could support other dads going through this, because it's not easy. And men don't tend to talk about it. They don't tend to express themselves. I think you would be, a really good pillar to other men to help them through this, because we all have emotions.
Yeah, I wouldn't mind, I guess serving as a resource. Today's the first time I'm actually even talking about this like that. The only other people I speak to this is my children. We continue to grieve because I know that's part of the process. But yeah, it's hard for me to talk about this. And I did it because Mr. Johnny Farias over here asked me to do it. But even to come out here and make time to do this is tough. I have to make arrangements. I just don't leave my children with anybody, and there's 3 of them. A lot of times, even if I leave them with one person, they're outnumbering that one babysitter. So you can already do the math on how much trouble they could cause. My children are great, but
No,
they'll be
and-
children. Kids will be kids.
And thank you for being here. I know, thank you all my guests for taking the time. I know it's difficult, everything that's going on. Nikki, one thing that he just said, just agreeing to do the treatment is a big mountain to climb.
Yeah.
What made you decide to do the treatment?
It's a tough question. I was very skeptical. I believe in modern medicine, but I also tend to lean a lot more towards being holistic. So it was a really big hurdle for me to accept that I was going to be doing chemotherapy. And not just chemotherapy, but my treatment plan was 16 chemotherapies. I ended up in the end only doing 14. We cut out the last 2, but it was really difficult. So my compromise to myself was to find a neuropath to help me along the way, help mitigate symptoms, and to help facilitate my body throughout chemotherapy and immunotherapy and everything else that I have gone through.
And it's stage 1, or what's the stage?
I was on the cusp of stage
Okay.
1 and 2. So I was originally diagnosed stage 2.
Okay.
Yeah.
How old is your child?
2.
2. They don't understand what's going on yet.
No, he doesn't understand at all. So he'll be 2.5 now in December. So right now he doesn't really understand much. I've had tons of help though, and my fiance has been the greatest thing on the planet. Wouldn't have been able to do this without him, but my child right now does not understand.
How is he taking it, if I may ask?
It's been hard. It's been difficult. Chemotherapy, as you know, is very draining. It's very difficult, roller coaster, and very lonely. And I'm sure for him it is. He tends to, bottle everything up, like how you were saying, but he's taken it really well. He's been a champ throughout the entire thing.
That's awesome, and my hat off to him too, because back when you as a man, I've been married 36 years now. So I've been with my wife, and we've been there with our children. So I'm very big on men, being responsible dads. And I know that a lot of men would have said, the majority, unfortunately, would have said, I didn't sign up for this.
Yeah.
And they're out the door. But the men that do hang on in there and take their responsibility, definitely those are the good ones, and the ones we need to keep.
Yeah.
More guys need to step up to the plate and do what's right. So I'm glad you found somebody. You have somebody by your side besides your mom and your dad.
Yeah, definitely grateful. My parents have been a big help. Obviously, again, my fiance has been an amazing help. He's been the greatest thing. And his parents as well. My mother-in-law, my father-in-law, his parents are divorced. So the step-parents as well have been amazing. I don't know what I would be doing without any of them.
That's good. I'm glad you have a support group. Resources. I know you were trying to get some other people on the show, but they couldn't make it because of circumstances. Tell us, what resources do young women have out there, or any women for that matter, that they can go to?
So first, I want to actually thank Talk Breasty to me. It is she's also a breast cancer survivor. Her name is Crystal, and she has created a support group for women going through all of this. I wouldn't have known about this if it wasn't because of my oncologist. So she actually went ahead and gave me all of her information. Thankfully, my hospital does a really good job of kind of spreading the word on the support groups that are there to help you and to help girls. Cancer can be a super lonely and treacherous journey. So having people that are going through the same situations as you make everything so much easier. 305 Pink Pack is another one. I'm actually a part of that organization, and the founder, her name is Rosemary, and she's also amazing. She helps with not only metastatic cancer, breast cancer, but every stage as well. And Brecca Strong, I believe, also is one of the biggest organizations as well that helps they fund money to be able to give girls and women these kits to be able to kind of get through chemotherapy a little bit easier.
Okay.
Yeah.
Yeah, if we're gonna get those names up on the screen, it'd be great. Brecca Strong.
Brecca Strong, 305 Pink Pack. And then Talk Breasty to me is just a support group, and she's been amazing.
Yeah, yes, we can Google any of these without a problem.
Yes, Google, Instagram, any of them.
That's good. I'm gonna follow some of them as soon as we get done.
Yeah.
Hey, one more following is good.
Yeah.
Me too.
Yeah, they've been great.
Okay.
I appreciate them.
Doctor, any other resources that you can mention that the audience can go to? Because, like you said, a lot of people say quiet because it's hard and it's lonely. So we don't make sure that they understand that they're not alone. They have many people out there, even if we don't know each other, we're there. Nowadays with social media, we're just a click away, not even 6 away. Now we're just a click away.
The most important thing, don't let yourself get to the resources. Preventive medicine.
Yeah. Preventive
medicine is so important. We don't realize how important it is. And if you feel anything, your body talks to you. Just a lot of times we're not listening to the signs. If you feel that lump, if you feel anything, run to your doctor's office. Because once I'm looking for the resources, I'm already positive. I've already missed that very important first step. People, we need to understand the importance of preventive medicine. And I'm a naughty person. I can have a pain and I'm like, no, it'll be okay. I am terrible. I am terrible at that. Even though I see, because I get the end. Once people come into where I'm at, you're really sick. Preventive medicine. There are a lot of resources out there. There are a lot of support groups out there. But let's try not to get there. Let's try to stay healthy. And like I said, I'm one that I'm terrible.
I think
I'm gonna learn that. Thank you, because I'm gonna try to. Hey.
I think we're all that, and one of the things I want to tell my audience is, I'm one of those too. We all tend to take our health for granted. And look, there's been times that I've gone to work with a fever, where I couldn't even see, but we got to go to work because we know we got to pay the bills. And it's understandable. But if you look, in the long view of it, if you get worse, you won't be able to work. So take that one time off. Nikki said that she waited about 10 months before she went.
Yeah.
I know we don't know if going sooner would have made a difference, but let's not wait those 10 months. Let's not wait till we get to the point that we can, when we got to call 911 for an ambulance or something. Let's prevent. I mean, as a person by experience, yes, I think that I beat my body up so much younger that now we're paying for it. And so to all the young viewers out there, don't do that. Take care of yourself now. So when you get to our age, you're in a lot better shape. Believe me, we're going to need it. So yes, definitely the preventive is the way to go. We're getting down on time because 30 minutes go by really fast. But one of the things I did want to, touch on, the mental health part of it. So I know, we need to do a show about mental health because that's one of our biggest things right now also, especially with the younger generation that, we talked about that don't know how to handle the stress and that causes them, to go into this mental health. You want to say something on that real quick and each of us?
Mental health is something so interesting because I'm looking at somebody that looks healthy physically, but when you start to talk to them, you see all the cracks. And mental health is so important because this is your everyday life. This is what gets you up in the morning to go to work. This is what helps you pay your bills. Right. This is what helps you understand and get along with people. We're seeing such a high incidence of mental health, whether it's depression, whether it's nervous breakdown, whether it's PTSD, so many people are going through so many things. That's another aspect. When I have 4 kids, I always took my kids at least once a year to be seen by a therapist. Not because there was anything wrong with them, but because I wanted to know, was there anything that I should be looking at? That's another thing. If you start to feel any kind of way, go see a therapist, go see a doctor. It doesn't make you, we need to get out of the I'm crazy or you're crazy.
There's a stigma.
It's not that you're crazy. You go through a lot of different things in life, and we have a lot of things that maybe we store that don't come out where we know exactly what it is. But when you go to a therapist and you go to a support group or when you have conversations, it starts to click in your mind, oh, yeah, maybe I have some hidden traumas. So mental health for our teenagers, for our young kids, for people our age is growing astronomically. We see so many patients with so many different diagnoses. So that's another thing. Going through something like this, going through what you've been through, can sometimes make you stronger, but sometimes you also need a little bit of help, a little bit of conversation privately to kind of help you sort through those emotions so
Right.
that further on down the line, you're in good standing with your mental health.
Being you said, I was going to ask Nikki, going through this, there has to be a mental health component because you're struggling. And like you said, you were skeptical about any outcome and about what's going to happen. How are you dealing with that?
It's tough. Getting diagnosed felt like that was it. I was, that was the end of it for me. But the way that I kind of pushed through, I guess, is I never saw anything other than I'm going to get through this. Never in my mind did I have a doubt that it would be anything else than pushing through and getting to the other side. So it's been a struggle, again, the beginning stages were rough, but didn't have a doubt.
Okay. Oh, I'm glad that you toughed it out, and like I said, thank you for all the people around you that helped also. Angel. Also there has to be some component, especially after. You have three boys, one of them very young. I wouldn't even know. I wouldn't even know how to ask you how you talk to somebody that young, but I'm pretty sure you keep an eye on that all the time. It's something that you got to deal with every day, day by day.
Yeah, all three of them. But with the young one, it was. I'll tell you something kind of odd, but I take it day by day. Like he knew his mom was sick, right? Took him to the hospital. The last days she passed away. I told him, like, I explained to him, and I basically told him like she's not coming back. And he kind of like consoled me, right? Like he'll put his arm around me and be like, "You're gonna be all right." And for the first time since she passed, he's mentioned her before, like, "Hey, I want mommy to come back," but he wouldn't cry. I think about like a week or two ago was the first time that he mentioned her and cried about it, right? So I took some time. We looked at pictures, and we cried together, right? And that's all we could do is let it out, explain to him, listen, we all love mommy, we all miss her as well, and this is what it is right now. We got to continue to live for her in her memory because that's what she would want. Trying to get your mind off of it all the time, I wouldn't say is the way to go. I think at some point you got to sit down and actually take that hit per se, right? Because it's gonna hurt explaining that to your child. With the other two as well, I ask them every so often, and I do it so in confidence, right, in private where they're comfortable, because putting these kind of conversations on folks, I don't know, it gets a little tricky, like you don't know how people are gonna receive it, how they're gonna feel later, because at the moment they'll tell you anything, but then maybe you impacted them, in a negative ways, so much so that they feel sad later on, right? You wouldn't want to put that on them without speaking through it and then having some kind of closure. So I think that's the most important thing with the children is giving them some closure, letting them know that you're here to support them, you love them, you care about them. And it's not just you, they have other family as well. I'm very fortunate, right? And lucky to have immediate family that's willing to support me. And, I think for those that don't, I think that's what the support groups would serve for. But, it would be really tough without all the support that I have because, it's three of them and there's one of me. So again, we do the math on that. I'm outnumbered, right? So, I just do my best, but I also tend to lean on family sometimes and my close ones to help me, just help them get through the day, and then continue to raise them, because they have a life to live just like we do, and then they're just starting out. So to me,
Right.
they're priority.
Wow. I mean, just I mean, I have no words, because I mean, I'm fortunate that I have my wife and my kids, and I'm not going through something like that, even though it's close. And I can say many things, but it's different. I get to go home and not see that you live in your own home, and even though you're my brother and we talk and I help, whatever, I know it's not the same. And like I said, I take my hat off to you, man. You're doing a tremendous job, and
Thank you.
but yeah, well, ladies and Angel, thank you so much. Our time has expired, but I definitely want to bring you back again. We talk more about mental health. That's something I know that's dear to your heart. About what we discussed. Nikki, we're here. I know you probably is up, but you'll be okay. I think you're gonna get through this. I've known you since Girl Scouts. You're a strong young lady, and I think you'll get through this. We're all gonna see you through this.
Thank you.
And Angel, you're my brother. We're here. To the audience, again, preventive, like the doctor said. Don't wait to the last minute. Don't put it off another day. Take your 3-4 hours now instead of your weeks and months later. Unfortunately, that because that's the math at the end of the day. So please be safe out there. Again, thank you, Community News, for allowing us to be here and talk about this. These are conversations that are hard to talk about. And even sitting here, I know it's bringing out emotions on everybody. It is for me. I ain't gonna lie. I'm a little emotional inside, because it's you hear all these things, and I have children. I got daughters. I got a granddaughter, and who knows? None of us never know. But I'm definitely gonna make sure they go to the doctor enough. Again, thank you, everyone. To the listeners out there, if I don't see you next week, you have a safe and happy Thanksgiving. Again, Johnny Farias out. Thank you.